Terrific. Thanks so much. Okay, well, welcome everyone. Today's presentation is how to spread the word about the public health emergency unwinding, and you have joined a webinar with Covering Wisconsin this May 27th. So welcome, happy Friday. I'm sure lots of people are looking forward to the holiday weekend. So my name is Shannon Drake Burr. I am the Workforce and Affiliates Liaison at Covering Wisconsin. I will be your host today, and I'll be manning the question and answer. So when you put your questions in there, I'll be sorting through them. I am so excited to introduce today's presenters, Caroline Gomez-Tom and Courtney Harris, also both of Covering Wisconsin. Caroline is our Enrollment Network and Accessibility Manager and has recently returned to us from a brief hiatus. And Courtney Harris is our Outreach and Partner Relations Manager. And I'm guessing they are likely both very familiar faces to many of you this morning. So please feel free to put your questions into the Q&A at any time. We will take strategic breaks throughout the webinar to address those. And please know that we have enabled what I think of as the vote the question up feature. So if you see a question in there that you also have, go ahead and give it a click, and we will then be able to see that that is a popular question, and we will do our best to address those questions first. We do have a lot of people on the webinar this morning, so please know everyone is on mute and we will not be unmuting participants. So if you have a question, the way to get it to us is to enter it in that Q&A. And we will do our best to address as many of those as we can. We know we may not get to them all, but we will take them back for future presentations and considerations. And also, if you didn't hear me before, we are recording this presentation and we will post the recording to Covering Wisconsin's YouTube channel. So with that, I'll hand it off to our first presenter.
Thank you so much, Shannon, and thank you everybody for joining us today. We know this is a really important topic, and we have a really wonderful number of folks who joined us today, and also a wide range of both existing partners who have worked with us for a long time, and some newer folks that we're really happy to see joining us today. Maybe for the first time. So with that in mind, before we kind of dive into all of the detail that we're going to cover today, we just wanted to start with some of the key messages and takeaways that, if nothing else from today, we're hoping that you leave feeling confident in sharing with your community. And again, we'll get into all the details behind this and the context and try and answer some questions that you may have for folks who need some more information. But some of those key messages that we'll cover today are the fact that no one will be losing Badger Care or Medicaid benefits before the public health emergency comes to an end. And we'll talk a lot more about what that means. And then some important action steps for consumers that we'll be covering today, and that we're hoping that you'll feel comfortable sharing, are that it's important that folks are keeping their contact information updated with the state, either by logging in through access.wi.gov or by working with their local income maintenance agency. And of course, signing up for push notifications through what is called the My Access app, which we'll also talk more about today. It'll also be important for folks to be keeping an eye on the mail and watching for a letter from the Wisconsin Department of Health Services so that they know when and how to take action when that public health emergency ends. And then, of course, first and foremost, even though it's the third message, it's really important for us to be spreading the message that folks can get free help from an expert in their community. You can call 211 to find enrollment assisters in your community, or visit wiscovered.com to learn more about the different types of assisters. And again, we'll talk a lot more about what that means. So what we will be covering today, like I said, since we have a really broad range of partners joining us, we're going to start with just some basics so that everyone is starting from the same place with a good understanding of who Covering Wisconsin is and what free health insurance enrollment assistance looks like throughout the state. And then we'll also talk about some of the basics of health insurance options for more context around what we do, but also the options that folks will have in relation to this process. And then we'll really focus on what you need to know about Badger Care and Medicaid during the COVID-19 public health emergency and some of those key action steps that consumers can take to prepare and how we can help. And then we'll close out with how to spread the word and really focus on some of the free resources, tools, and then share some of the creative ideas that you all shared with us already when you registered for this webinar that you're using to spread the word, to hopefully leave on kind of an inspirational note at the end. All right, so just diving into some of the introduction information about Covering Wisconsin, who we are and what we do. Covering Wisconsin is a nonprofit that helps folks in Wisconsin find and use health insurance. We are based out of the University of Wisconsin here in Madison, which is why you'll see our @wisc.edu and our email addresses, but we have navigators that are located throughout the state and we serve the public statewide. And we fulfill that mission in a number of different ways. First and foremost, by serving as the state's health insurance navigator agency. And we've been serving in that capacity and have received a grant from the Centers for Medicare and Medicaid Services to perform that role since the marketplaces rolled out back in 2014. And what that means is that we have expertly trained and licensed navigators on staff that provide free one-on-one health insurance enrollment help statewide. And we'll talk a lot more about what that means. And we also do a significant amount of outreach and education, both directly with consumers and for partners and professionals like you all throughout the state on a variety of health insurance related topics. So health insurance navigators. Health insurance navigators are a wonderful free resource that serve as a free health insurance enrollment assistance resource for folks across the state year-round to understand health insurance questions. We always say there's really no question too big or too small. If you have a question about your current coverage or are looking for some help finding health insurance, reach out to us and we can help direct you or answer your question ourselves. We also provide free help in finding plans and financial help and help folks sign up for coverage primarily through healthcare.gov or the federal marketplace, and then Badger Care Plus and Medicaid, which is of course what we're focusing on today. And then enrollment help doesn't just stop when folks are signed up for coverage. We also help folks make sure that they're able to access healthcare services. And if they're running into issues with billing or getting services covered, maybe need to file an appeal with their insurance company, navigators also provide assistance with that process and in connecting to other community programs that help pay for health insurance or healthcare services throughout the community. And although Covering Wisconsin is a statewide resource as our statewide navigator agency and is our primary local navigator contact in several areas of the state, like you'll see on this map, we also work with a network of health insurance navigator agencies and nonprofits throughout the state. So some of you located in different areas of the state may have relationships with some of these partners already, and maybe you work with them as your health insurance navigator, or maybe you didn't realize that they had a health insurance navigator on site at their agency. When we send out these slides after the webinar, you'll be able to click on this map and it'll take you to a live map so you can look at your region and who the health insurance navigator agency is locally. And then also this map has contact information for the primary contact at each of the navigator agencies as well. So hopefully you see some familiar names throughout our network. And then in addition to health insurance navigators, we also work really closely with our partners throughout the state that are certified application counselors and many agents and brokers as well. So when we say enrollment assisters or health insurance enrollment assisters, that's to be inclusive of all of these certified agency enrollment assister types. And most importantly, we want folks to know that there are free health insurance enrollment assisters in your community at any of these different license or certification levels. And when we talk about tools later on in this presentation and how you can find a health insurance enrollment assister in your area, you can be assured that the tools that we're directing you to will connect you to a free and certified expert that is in one of these different categories as an enrollment assister. And then we just wanted to take a second to define what we mean when we say mobilizer. You might hear us talking about mobilizers throughout this presentation. And what we mean when we say that is that many of you serve as trusted community partners in your agents, in your communities. You are a voice and organizations that have relationships with folks in your community. And you may help spread the word about really important health insurance topics like we're covering today, but might not directly help folks with enrollment. I know some of you do, but that's not a requirement of someone that may be serving as a mobilizer. And just some examples of the types of organizations or individuals that we're speaking of when we talk about mobilizers. I know some of you have community health workers on staff, for example, or you may just be an individual who is a trusted member of your community and is interested in spreading the word to folks locally about topics like this. And then I'm going to hand it over to my colleague Caroline to touch on some more context.
Thank you, Courtney. And thank you all for being a part of this presentation today. I'm really excited to have you all here, and I'll be getting into our basic health insurance options so that you have a good understanding of what we mean when we say navigators can help with the different health insurance options that are available here in the state of Wisconsin. Next slide. Oh, perfect. So we'll be doing a brief overview of the Badger Care Plus and the healthcare.gov marketplace options. When you think of Badger Care Plus, you'll also hear the state's Medicaid program, which is what it is, and then also the Forward Health program, just because a lot of folks that have Medicaid, Badger Care Plus, recognize it by the card that they're given by the state, which says Forward Health. So just know that when I talk about it, all three of those names are the same program or the same umbrella program that people can be eligible for. And then when I talk about healthcare.gov, I'm also talking about the Federal Health Insurance Marketplace, which was created by the Patient Protection and Affordable Care Act. Back in 2010, the first open enrollment period for the health insurance marketplace was back in 2013. And we're really pushing our community partners to start using healthcare.gov when they talk about the health insurance marketplace, because we have seen an increase overall in people getting confused and or scams that are readily apparent across the internet when you start to search for health insurance marketplace. And the difference between healthcare.gov and any other healthcare.com, healthcare.org, healthcare.net can be the difference between someone getting legitimate help with their health coverage with a discount or getting involved in spam phone calls, assistance from other states that don't know the needs of that person here in Wisconsin, and frankly, a large list of other potentially concerning practices. So we really want folks to emphasize healthcare.gov. So to start, we'll talk about Badger Care Plus, the state's Medicaid program. And this is the program that's available at low cost or free, depending on the individual circumstances. And it's available to adults, pregnant women, children, and people who are considered elderly, blind, and disabled. And it also depends on some other factors, but mostly anyone can be eligible with qualifying eligibility as it pertains to income, and as I mentioned, some other factors, but we're not going to dive deep. This is available all year round. So there is no open enrollment for Badger Care Plus, and our navigators are very good at helping folks navigate the system. See what I did there? Navigator, navigate the system through our partners at the Department of Health Services and our partners at the Income Maintenance Consortia offices where Badger Care eligibility is determined. So then we have the health insurance marketplace, healthcare.gov. And this is where people who don't qualify for the state's Medicaid program or any other type of health coverage can go, one, to get a private health insurance plan, also find out if they qualify for financial assistance that helps them lower the cost of their monthly insurance. And they do have an open enrollment period every year, which is November 1st through January 15th. However, there are a long list of special enrollment events that could create a special enrollment period that we'll talk about a little later in the presentation. But people can qualify for financial assistance up to a very high level of income. And so many people, the majority, can usually find a plan that's very affordable for their families. And because of the COVID pandemic, in response to that, there was a law passed, the American Rescue Plan Act, which I imagine many of you have heard of for various other services that have been provided to the community. But it also helped with the health insurance marketplace, healthcare.gov, in creating more opportunities for people to qualify for that financial help. So right now, from 2021 and now 2022, 4 out of 5 people will find plans available to them for less than $10 a month. And then there are $0 plans, so free plans available to people up to 150% of the federal poverty level. I like to use real numbers. So what does that mean? For a single adult, that's someone making up to $20,000 in a year, or a family of 4 making up to $41,000 a year will now be eligible for potentially plans that have 0 cost to them in the marketplace. And then no matter your income, another part of this policy is that you can get help. You can get those discounts, even if you're above the original limits of discounts, if your insurance would be more than 8.5% of your income, which means there's just more opportunity for people to qualify for those discounts if insurance otherwise would be very expensive to them in the marketplace. So we really encourage folks to look again if they haven't looked in a while on healthcare.gov. And then special enrollment periods. I tend to talk fast. Sorry about that, guys. Special enrollment periods on healthcare.gov can span from someone losing their insurance. So if someone were to lose their job insurance, Medicaid, COBRA, school health plan, they would have 60 days before or after that loss of coverage to sign up on healthcare.gov. If there's a change in household size because of a death, a birth, an adoption, if someone's moving to a new county, so if someone's moving from Milwaukee to Waukesha, that would trigger a special enrollment period if that means there's a change in their insurance. Immigration, so if someone is changing their status, let's say from having a work permit to someone who now has their green card, their permanent residency, that would also allow for a 60-day window before and after that change in status. And then if someone is released from incarceration. And then there's other reasons that people can qualify for the special enrollment period. And you can go on our site to get this how-to sheet specifically that shows all of the options. But one that I really want to emphasize that's recent, and as part of that American Rescue Plan Act change, is that people who are below that 150% FPL, federal poverty level, or that single individual making less than $20,000 can qualify for a special enrollment period all year long. So anyone under that limit can get a special enrollment period at any time of the year. And And then people also can get health insurance through their job. And that's actually the first place that our navigators will look, because if their job insurance is considered affordable and adequate, then they do technically have to go with their job coverage, because they would not qualify on healthcare.gov for the tax credits. They could still purchase on healthcare.gov, but they would have to pay at full cost because they have affordable and adequate under the law insurance through their employer. So we are great assets to those individuals to help them figure out if their job insurance over healthcare.gov or any other options make the most sense for their families. And we're also reviewing or overseeing this change that's happening at the federal level, where there's potentially a chance where more families will be eligible for tax credits in the marketplace because their work coverage is considered unaffordable. And there's a policy that might make it more available, those tax credits, to family members. So we're watching that, and the navigators are going to be the great resource for you to help understand that. We understand health insurance is very complicated, so we do not expect you to absorb this information and take it and run with it. What we want you to be able to take away is that if you have any health insurance question under the sun pertaining to anything that we've talked about, you can say, you know, I know about Covering Wisconsin. Let me send you their way, and we'll take it from there. So then finally, Medicare is another option that many folks qualify for. Individuals who are 65 and older and have had, enough work credits, but typically most people who are 65 and older qualify for Medicare. And then individuals that have been on disability for at least 2 years can also qualify for Medicare. And you may be familiar with Part A, Part B, Part D. So it gets complicated. And so navigators are a great resource, not necessarily to sign people up for Medicare, but help people transition from the current health insurance they have to the Medicare options that are available, and getting them to the right agent or broker or Medigap specialist, people that know what they're doing, and we can vouch for that referral to the appropriate party and make sure that people are in the right hands. And then now I transition it back to Courtney. Thanks, everyone.
All right. And I did see that we had a couple of just questions about options. So Caroline, do you want to go ahead and answer those quickly before we move on to this section?
Sure.
What do you think, Shannon?
Yeah, so the first question, I can read it out loud, is, does health insurance from a job impact getting Badger Care Plus?
It is possible, but it's usually less likely for health insurance through a job to impact someone's eligibility getting Badger Care Plus. And this is another reason why navigators are great friends to have when it comes to these types of insurance nuances, because they'll know to look, and really at the end of the day, the best bet is to apply for Medicaid anyways, because navigators nor individuals nor community partners will be the person that determines that person's eligibility. It will be the state of Wisconsin and going through that process. So if all else fails, apply. If that fails, ask a navigator, or even better yet, proactively ask a navigator for help.
Great, thanks, Caroline. I think I'm going to clarify the second question that we have before we get to it. So I think we can go back to Courtney for now, but we will return to this question once I get a little more clarity on it.
And Shannon.
Thanks, Shannon. All right. And so I am going to dive into some of the meat of why we're here today. What is really important for folks to know about the Badger Care and Medicaid programs specifically, and how we can spread the word about those changes. So during the COVID-19 public health emergency, there have been special rules in place, and I know this was on Caroline's slide earlier, for Badger Care Plus and Medicaid, and those special rules paused renewals and terminations throughout the public health emergency, so since March of 2020. And what that means is that annually, usually once a year, folks need to go through a process to renew their Badger Care Medicaid coverage to make sure that they still qualify to stay on that coverage through the next year. And throughout this whole public health emergency, those renewals have been paused. Similarly, if folks normally would have a change in their household situation, maybe an increase in income that would make them lose their Badger Care coverage, those terminations have also been on pause. So anyone who has been eligible for Badger Care or Medicaid since the beginning of the public health emergency has stayed on the program because of those special rules. And then once this federal public health emergency ends, members will need to complete a renewal, or in some cases, a new application to see if they still qualify for the program. We know right now that those special rules are likely to remain in place until at least mid-October, and that federal public health emergency declaration is something that is extended usually at 90-day periods. So every 90 days since the beginning of this public health emergency back in March 2020, that the federal government makes a decision about whether that public health emergency will end or if it will be extended, and those special rules will remain in place for another 90 days. We should know by about mid-August if those special rules and the public health emergency is likely to end in mid-October or if it might be extended again. And so what is the challenge here? And why is it so important that we have community partners like you all helping us throughout communities across the state, get folks ready for this change and help plan and prepare so that they know how to take action when that public health emergency ends? Well, first, after the emergency ends, like I mentioned, everyone on the program will need to go through that process to renew or submit a new application to see if they still qualify. In Wisconsin, that's about 1.5 million individuals. And so because there are so many folks that will need to go through this process when the emergency ends, the states all have about 12 to 14 months to get everyone through that process of renewal. And what that means is that members will have different dates spread throughout that 12 to 14 month process when the public health emergency ends, that they need to take that action. So not everyone takes action at the same time. And members should really not take action to submit their renewal or new application before the date that they're given throughout that 12 to 14 month process. To prevent them from potentially losing coverage earlier than they would otherwise following the end of the public health emergency. And that creates a real communications challenge because some of the action steps and key messages that we're going to be highlighting in just a second, that means that we need to share them now so that folks know that this will be coming eventually and the steps that they can take to prepare. And then once the public health emergency ends, we'll need to keep sharing those messages, and throughout that 12 to 14 months after the emergency ends, we'll need to continue to share that message so that folks that maybe need to take that action at the end of that period don't miss that message and are still prepared. Likewise, given the volume of consumers that will be needing to take action at the end of the public health emergency, it's likely that it will be more challenging to call in and get some of those actions taken over the phone, which means the state is really encouraging folks to use some of their online tools, Access and the My Access mobile app, to take some of those steps to renew, to update their contact information. And we know that can be challenging for folks who may not have access to the internet or just may need some support as they go through that process and using some of those resources. So it will be especially important that we have folks like you all in our communities helping folks through this process or connecting people to navigators to help them prepare and then complete their renewal and complete this process. So what will this look like? there are some really basic changes that will happen when the emergency ends. Once that public health emergency ends, whether that's in mid-October or beyond, the Wisconsin Department of Health Services will send letters and text messages, in many cases, to Badger Care and Medicaid members, telling them when they'll need to renew or if they'll need to submit a new application. And like I said, not all members will need to take action at the same time. So folks will, in that letter, will get that notification of their assigned new renewal date or when they need to submit their new application. And throughout this whole process, it will be really important for folks to kind of continue to reiterate this reminder that there are navigators and other enrollment assisters who are here to help folks navigate this process and to complete their Medicaid renewal or new application, or to pursue one of those other options that may be available to them that Caroline covered earlier. What are the key action steps that members can take and that we can help support members in doing as they prepare for this process? First and foremost, it will be really important for folks to keep their contact information updated with the state. And that means their address, phone number, and email address if they have one. And they can do that by logging in at the access.wi.gov website or by calling their local agency. Folks can also download the My Access app, which Caroline will talk more about, and sign up for push notifications to get an alert when it's time for them to renew. So that's a really helpful, proactive way for folks that are a little bit more tech savvy to take action now to make sure that they're notified when they need to take action at the end of the public health emergency. And then, of course, be watching for a letter from the Wisconsin Department of Health Services so that they know when and how to take that action. And then, given all of that context and all of those steps that will happen, what are some of the key ways that you can spread the word about some of those important action steps and how to support members through the process? First and foremost, we're really fortunate that the Department of Health Services has put together a toolkit of free resources that partners can use to help spread the word about these upcoming changes and the key steps that members can take to prepare. And this is what they call the Unwinding Toolkit. When those special rules end or they unwind, these are the steps that consumers will need to take. So you can see an example on the screen here. And these are ready to use flyers, social media tools, outreach cards, and more in English, Spanish, and Hmong in many cases. And some can be personalized with your organization's information. Covering Wisconsin also has a toolkit of resources available in English and Spanish on our website that includes ready-to-use social media graphics, and we post videos there as well, and also printable materials, downloadable and printable materials, outreach cards like you see here, and flyers. And those can also be personalized with your local enrollment assister contact information. So please, I'll share my contact information at the end of the presentation. If you're interested in getting some of these outreach materials printed with your local enrollment assister contact information, please reach out to us and we can get those for you. We also, Covering Wisconsin, has also personalized some of the DHS toolkit items and now have them posted in our toolkit for partners to use to spread those important unwinding messages, but also to include that referral to free health insurance enrollment assister help for folks with that process. We also have free educational resources available on our website. These cover in great detail, but following important health insurance literacy concepts in English and Spanish on a lot of the topics that Caroline covered earlier and that our navigators use to work when they work with consumers through this process. We have those available on our website for free, and we'll be continuing to add more of these educational resources as we go through this process. So there will be one coming soon, for example, that is specific to this topic of what should you do if you lose Badger Care and Medicaid? What are your other options, and what steps should you take? So this is a good resource to bookmark if you haven't used it in the past. And then finally, social media. I know from some of the answers that you all shared of ways that you're already spreading the word in your community, that many of you are using social media and use Covering Wisconsin social media posts as examples to reshare, which is wonderful. So if you're not already following Covering Wisconsin, the Department of Health Services, and some of our partners at the Office of Commissioner of Insurance or healthcare.gov, these are great accounts to follow because we will all be posting updates and information about the public health emergency as we learn more, that you can then repost to just continue to spread the word through social media using these already made posts in your community. And I'm going to pass it back to Caroline to share some other tools and tips.
Wonderful. Thank you, Courtney. All right, so our first tool and tip is finding out where you can get help with one of our local enrollment assisters. And so we have a find and schedule tool, which is our connector tool, where you can go to coveringwi.org/enroll. And when you're with someone that might need help finding an appointment, you can enter their zip code and language that they prefer and find someone that can speak the language. So English and Hmong are our common languages that our navigators speak, but we can serve other languages with a language line or an interpreter, and then find that local assister, make an appointment, and the appointment scheduled reminder will come to them on their cell phone. It's just as simple as zip code, phone number, language, and you're good to go. You can also call Covering Wisconsin directly, and one of our navigators will pick up or get back to you within 24 business hours and set you up with an appointment. We'll also make sure that we're setting you up with someone that is local to your area or local to that consumer's area. And then calling 211 is also a resource statewide where people can find a local assister. 211 is a great partner to us, and we work collaboratively with them to make sure that they have all up-to-date information about our enrollment assisters across the state. And then new to Covering Wisconsin and to resources available for our partners is our live chat feature on our website. So we have this little green box that you see on the slide where people can do a quick screener of what they might qualify for. They can set up an appointment, and that actually will get them through the connector tool through the chat feature. And then if they still have questions, they can ask to chat, and we'll have the ability to talk live to one of our navigators. This is a brand new tool, so we're still kind of working through the system, figuring out what works, what doesn't. It just launched technically a week ago or so. And we have about 1 to 2 navigators a day that are checking to see if there's chat updates. So I'm hoping that this system will work for you, and let us know if there's anything that we need to react to or update or change, because we're learning along with you. But we're hoping that this is another feature for folks that don't necessarily like picking up the phone, might not like asking questions in person, but would be very comfortable sending a quick message to someone who knows what they're talking about. Next slide, please. We also have a screener tool on our website. We also, so it's a 2-question tool that people can put in their household size and their income and get an idea of what they might qualify for. We also have here linked the Am I Eligible resource, which is on the access.wi.gov page, which helps kind of understand if you might qualify for the programs that are available through the state, which would be not just Badger Care, but also food share, child care, et cetera. And then, as Courtney mentioned earlier, the My Access app is a huge resource and one that we really recommend our partners talking to folks that you serve about, because what we've seen is, one, when someone has the My Access app on their phone, they're more engaged with their benefits and are more likely to know kind of the status of what's going on. On the app, you're able to see your renewal date, so that'll be important when they have a renewal date to respond to or to act before. They can also get reminders of things they need to do, for example, like submitting documents. They're able to submit documents through the tool by taking pictures of their check stubs or other proofs and verification that they might need to submit in order to maintain their coverage. And then one thing that I love to talk about is that the My Access app also has a copy of their Forward Health card. So a lot of times people will lose their Forward Health card and they will have to call in order to get a new one. It's not automatic once they renew or reapply for Medicaid. But if you have the My Access app, you can have that card with you at all times. So you never have to worry about losing it again. And so you just have to search My Access Wisconsin, and it's a quick free download. And if they already have a login, it's logging in and using, or sometimes they might have to create a login with their case number or their Forward Health card number. And then another tip that we can't mention enough is that we are free, local, unbiased help. Because we're federally funded, we have no skin in the game in terms of selling insurance products. And we know that there are a lot of folks out there that capitalize on moments like this when there's a big transition between people getting new benefits, when there's a change in policy at the federal, state, or local level, or really if there's just anything that might detract because there's too much information available. So really knowing that you can trust an entity is really important in this moment. And of course, I have to keep reminding folks, healthcare.gov, healthcare.gov, healthcare.gov is the site that people go to sign up for health insurance through the marketplace. And that's where they can get the tax credits. But like I said, if you can't remember anything, just let them know that they can reach us at Covering Wisconsin. And then we asked our members or our participants today, what are some of the things they're already doing? And we were really pleased to see the things that you shared. So some folks are contacting existing clients to share their information via phone and during home visits about the public health emergency ending and what they need to do to prepare. So thank you for doing that. Some folks are sharing Covering Wisconsin's posts on social media. They're adding this topic to their community events and discussions, even requesting Covering Wisconsin to attend their events. So if you guys have a health fair or some other community event that would make sense for us to attend, please let me or Courtney know. And then some folks are posting articles about this issue in their newsletters or local newspapers, posting flyers, distributing outreach cards at their office, and then presenting similarly to what we're doing with you all, but maybe at a more manageable bite-sized version to the community partners across the state. Because really at this point, I like to emphasize that during that first open enrollment period, we had 47,000 people transition from the state's Medicaid program to healthcare.gov, to the health insurance marketplace. And that required partners from across the state coming together and working on these issues. And now we're talking about 1.5 million people alone needing to renew and reapply. And we need you. And we appreciate all that you are doing now, but even just knowing a little bit about this transition will help us get this work done and will help a lot of people keep their coverage and still be able to access the healthcare that they need.
Absolutely. And we know, of course, that communities across the state are unique, and that's where you all as mobilizers really come in, is so important. Like Caroline shared, there are so many different creative ways that folks are spreading the word about this change or other health insurance or other topics that you may work on as an agency in your community already. So what we're hoping to do today is give you some key messages to use as you're spreading the word, and some free tools and resources. Not to say that you need to use all of these exact tools. Like if your agency doesn't use social media, it's certainly not our expectation that you're using these social media resources, but that you know the best ways to reach your consumers and to spread messages in a way that really resonate in your community. So hopefully you can take some of these resources and key messages today and incorporate them into some of the outreach work that you're already doing. And again, just want to close out with some of those key messages. So I know this was a lot of information, but again, some of the main messages that we're hoping you now feel a little bit more comfortable sharing locally with your clients and your consumers, or with your community more broadly, is that this reminder that no one will lose their Medicare or Medicaid benefits before the public health emergency ends, but to keep prepared and make sure that folks are notified of the actions that they need to take when the public health emergency does end. It's really important to keep contact information updated with the state, and to sign up for things proactively, like those push notifications through the My Access app. And then, of course, to be watching for letters from the Wisconsin Department of Health Services so that folks know when and how to take action when the public health emergency ends. And finally, to get free local help from a health insurance enrollment assister by calling 211 or using our new chat tool, our website, or any of the other tools that Caroline shared with you earlier to find a navigator or other enrollment assister near you. And we also wanted to kind of just summarize with a few key takeaways or actions that you can take right away to help with this process. So first and foremost, like we've been talking, just spreading the word about these changes to come to your consumers and your colleagues. We do have, through Covering Wisconsin, some mobilizer mini grants available to help support organizations like yours in spreading the word about this change. So if you're interested in learning more about those mini grants to really help support your outreach activities, please reach out to me, and we'd love to work with you on that. You can also, of course, offer consumers help at your organization in taking some of these steps. So in updating their contact information, in figuring out how to use that My Access app, or you can make referrals to Covering Wisconsin or other health insurance enrollment assisters for that help. And then, not to steal Caroline's thunder, but you can also connect with others in your community. Caroline is working on putting together regional enrollment networks, reinvigorating some of them that were around when the marketplace rolled out many years ago. So if you're interested in just connecting with others in your community who are doing this similar work, staying informed about these changes and other important health insurance related topics, reach out to Caroline and she can connect you with the regional enrollment network in your area. And with that, I think we'll open it up for more questions.
Great. Thanks so much, Courtney. And thank you as well, Caroline. That was a great presentation. We appreciate your time and expertise. We do have a number of questions, some of which I've partially answered in writing, but I still want to address out loud. But I think let's start with actually the last question in, which is the extension to mid-October. So this is talking about the public health emergency extension is just for medical, not for food share or childcare. So can you clarify that?
Sure, great question. So that mid-October date is actually for the federal public health emergency overall. So that includes any state-based program that is tied to that federal public health emergency. So for example, the extra food share emergency allotments that are connected to that federal public health emergency would also continue through whenever that public health emergency ends, which is right now mid-October. So it is not just the Medicaid changes that would change at that time. It is any kind of state program that's connected to that federal public health emergency declaration.
Great, thanks so much. And just so you know, I put in the link to the Wisconsin Programs Eligibility Policy Update Call Series. So about twice, I think it's twice a month, DHS hosts a call where they address public health emergency policy questions with stakeholders. And so those calls generally talk a lot about both healthcare programs and also food share. So thanks. I will get, somebody has asked about the DHS Unwinding Toolkit website. I will get that answer in there. I wanted to go back to an earlier question, which was about Badger Care, the Badger Care Prenatal Plus plan, and if that coverage has been maintained throughout the public health emergency for people even after they have delivered a child.
Yes, it has. So this extension of coverage has applied to all Badger Care, or the majority of Badger Care and Medicaid programs, including Badger Care plus prenatal.
Yeah, and can we speak specifically to that provides regular coverage, right? This isn't, there is a question about, does it provide more limited services coverage versus normal Badger Care Plus?
That's a really interesting question. And I know it's one that we've covered in the past. Caroline, maybe you can speak to that a little bit. My understanding is that the extension applies to the program as it exists today. So the coverage that a member would get under Badger Care Plus prenatal is what would be extended, is what they're continuing to have during the extension of the public health emergency. But either one of our colleagues from DHS who is on the webinar, or perhaps Caroline or Shannon could correct me if you think I'm wrong there.
My understanding is the same as yours, Courtney, that Badger Care Prenatal the services that are provided are for the wellness of the mother as she is preparing to give birth. And so those services would be maintained after the fact because of the public health emergency, but it would still be the focus of I guess, the services available to that person.
Great, thank you both. I wanted to address in part a question that came through earlier about marketplace coverage for folks who are members of federally recognized tribes. So Caroline, maybe you can just talk a little bit about the special considerations for those people. I don't know that we can address, there was a question specifically about INS paying part of premiums. And we're not in a position to address that, but I think we can address the unique benefits and protections that are available for members of federally recognized tribes.
Yes, so folks that are a part of federally recognized tribes do have additional benefits when they go to healthcare.gov that include lower out-of-pocket costs like copays and coinsurance and deductibles for certain plans at a higher income rate than the general public, as well as a all year long special enrollment period. So folks can qualify for a special enrollment period at any time of the year for healthcare.gov coverage. And those are the two big standouts.
Great, thanks so much, Caroline. We had a question about what if a client lost food share or childcare benefits and should not have? I just wanted to say out loud that you should email the DHS Forward Health Partners inbox with that issue. They will help you address that question. So I put that email address in the chat. That's a great question. Okay, let's see.
Looks like we have a couple of questions about that, like situations where maybe consumers were notified that their coverage would be ending maybe in June or sometime before the end of the public health emergency. And in all of those cases, it would be a good idea to reach out to your IM agency to look into that case specifically, or to follow up with the mailbox that Shannon put in the chat.
Great. Thanks.
Or if it's healthcare related, also reaching out to your local navigator and having them do that with you. People don't have to do this by themselves.
Thank you, Caroline. Thank you, Courtney. Okay, we've got a great, I think, just case example that probably comes up a lot, which is I had a person come into my office stating she notified DHS of her new job and income. And she started to receive, she received a notice that her coverage would terminate at the end of June. Would her coverage not be extended to mid-October? And who should she call to verify this?
So that's exactly the type of case that we were just speaking to, absolutely. So if you have a case like this, definitely take one of the steps that we just mentioned. So following up with the IM agency, reaching out to a navigator for help with that process if you can, or following up with that email box that Shannon put in the chat with some specific case information to follow up, because that extension should continue through mid-October.
Yeah, and I'll just add that, we have heard of this issue in the past, and what DHS has shared with us is that some of those letters are unfortunately automated. And so even if someone gets a letter that says that their coverage will continue, but we understand that that's a uphill communication battle. And so getting the help of a navigator, getting on the phone with the IM agency so that the consumer hears it directly from them, those can all be really helpful things. And also, if for some reason after doing those things, there are still issues, then emailing that partner inbox with some case specifics can be very helpful. So we had a question earlier about, would you recommend that if someone has an increase in income after the PHE ends, that they report the change right away or wait until their renewal? I'm guessing if they report a change in income before their renewal that puts them over income, they would lose coverage. Do we want to?
Yeah,
it's a great question.
I saw that Maciel, one of our colleagues from DHS, did respond in the Q&A with some thoughts on that question. I think that might be a good one just to take back. I think that's probably going to be a common question that we get when the public health emergency does end. So I think it would be a helpful one to just get a little bit more clarity, and maybe we could follow up afterwards with some more information about that answer.
I agree. We can clarify sort of how this works and how the renewals work. But Maciel did respond, yes, a good rule of thumb is to report changes in income within 10 business days. But we can follow up on the detail of that question. Okay. Oh, and we had somebody else from an IM agency say members that receive benefits from IM still have reporting rules that should be followed. So just further encouragement for reporting those changes. Let's see.
I know we had a couple of folks, I did respond to that question about the link to the toolkit. So I put links in the chat to the DHS Unwinding Toolkit again, and the Covering Wisconsin Toolkit. And then we'll also send out the slides that have those links as well.
Great. Let's see, we are at 11 o'clock. I'm not seeing any new questions come in, but we'll give it just a minute. All right, I think we can wrap it up for today. So thank you all for joining us. We really appreciate it. We encourage everyone to complete a webinar evaluation. It really helps us to assess the quality of our webinars and what we can do better next time. So please take a moment to complete that evaluation. I will put the link. Oh, someone beat Courtney. Courtney beat me to it. Thank you, Courtney. She put the evaluation link right in the webinar. We encourage you all just to click that link now, hop over, take 2 or 3 minutes and complete it. It's always great to do it very fresh after the webinar. So, but we will send it out in the follow-up email as well. So here, if you have any questions, you can reach out to Courtney at 608-262-1838 or at her email, which is listed there, or you can call Covering Wisconsin, the general number, and we will do our best to answer your question and connect you or the consumers that you're assisting to the best resources available. And I see Caroline also shared her email address if you want to reach out directly to her with any questions. I'm just seeing if anything new came in, and I don't think it did. So thank you all for joining. We hope you have a wonderful weekend.
Thanks, everyone.
Happy Memorial Day, everyone.